All right, we're live. Good morning, everybody. Welcome to PT on Ice. My name's Jessica Davis, and coming to you in Pittsburgh, Pennsylvania on another gray day, typical for Pittsburgh. So today, I am the head instructor for the Performing Arts Division, as well as teaching some of the spine management courses. So today, though, the topic is going to be dance related. I was asked, and as ask and you shall receive, I was asked to do a segment on returning to point work following an ankle sprain. So a few of you reached out to me, and as a reminder of that, if you ever have an idea or something that you want me to talk about, please don't hesitate to reach out to me, because I love to present on what you're interested in so that I can complete that. When a dancer suffers an ankle sprain, it is a significant deal, and if we look at the research, it's one of the most common injuries that a dancer will face. So as we know, it's a common injury, and it can be quite challenging to treat because dancers lack that neuromuscular control, and the difficult thing is they need to be able to get into that fully plantar flex position, and when they're in that fully plantar flex position, we know that that's a precarious position because all it takes is a slight inversion type movement where they will again re-injure that. So when it comes to that, I want you to think about early on, like dividing this into different stages. So as therapists, whether you've worked with a dancer or not, a lateral ankle sprain in the beginning is going to be similar to any other treatment. We're going to be thinking about restoring motion, getting the inflammation down, getting the pain under control. And in the same regard, with a dancer, what you want to do is address fear, right? So when a dancer comes to you and they're clearly afraid that this is going to be something that's going to prevent them from getting back to what they need to do, you need to assure them that they will get back. And I think it's very helpful if early on you can use their terminology, and I've talked about this multiple times, that using their terminology, connecting with them, building that patient rapport and that confidence that they have in you, that you know what you're doing and you can get them back to their dancing. So early on, and you can look back at some of my videos, but those early exercises of getting the dancer in their side and working on the ballet bar type activities, that's been shown in the research to be very effective. And for a dancer, they'll feel confident and they'll be happy to be doing ballet specific activities when they have this injury early on. And when you can get them back to weight bearing, it depends on, of course, the acuity of the injury, right? So, and the level of injury, whether it's grade 1 and so forth. So if it's low grade and you can get them into weight bearing, that's what you want to do early on as soon as possible. And get them into positions of dance specific postures, right? You would start with parallel, and then you're going to work into turnout postures and different ballet positions and take them through the different repertoire. I found a really neat article that I'm going to show you just because I think it's easier if I just show you the actual article itself. So I'm going to turn this around. This is a phenomenal article for just dance injuries in general. So this was written by Dr. Liederbaugh, and she's just a phenomenal researcher and therapist. She's also an athletic trainer. So this is called Perspectives on Dance Science Rehabilitation, and it's understanding the whole body mechanics and 4 key principles of motor control. So what I love about this and why this is imperative for what we're doing is when we're dealing with an ankle sprain, we know it's a motor control issue, right? So when you look at this article, it really goes into some very nice functional type exercises that you can do with your dancers. And I'm going to show you a picture of this because time is of the essence, but taking them through these different types of functional movements here. And then one of my favorite parts about this article was this rehab 4-stage protocol. So if you look at it, she goes into stage 1 and she defines that as a restricted stage, and she'll go into what your clinical goals are. So if we're applying this to an ankle sprain, it's reducing the swelling and getting active rest and so forth. And it talks about in the studio what that dancer can work on, taking them again through the floor exercises or a pool class. And then it goes into what we're going to be at the restoration stage, reacquisition, and refinement. And so it's looking at different goals that you would look for, kind of building them up. And I love how she includes like speed and load and dynamic balance. And then we get into how are we going to take this into the dance class, because if you're not familiar with dancing, this is just a very helpful resource to get you into these types of activities. And then she goes further into a very functional progression for dance, going from different movement patterns, addressing cardiovascular strength, exercise, and even into jumping and concentration. So even getting into the mental aspect of what they need to be able to do, and it's very important for dancers to be able to perform that recall. So I love how she divided this up, and you can apply this to an ankle sprain and its progression, and even into this functional training exercise, going into specific exercises and how you would progress that as that patient gets better. So I highly recommend this article. It's from the Journal of Dance Medicine and Science, and I believe it was published in 2010. So let me double check. Yes, 2010. So reference that article and apply it, of course, to any dance-related injury, but addressing the ankle, you could think how this would apply. So what I wanted to show you today are a few different techniques and how I would progress my dancer. So in the acute phase, right, as we talked about, we're gonna get that dancer, come on over, I've got Amber today, yay! So in the acute dancer, one of the things that we might do is do some taping. Now when you're taping the ankle, it's a little bit different with a dancer because you don't want to have, often with our taping techniques, we'll wrap around the Achilles, and when they're in a fully plantar flex position, go point your feet. When they're in a fully plantar flex position, it's going to irritate if they have tape over her Achilles. She's not gonna like that, that will rub. So if there's a way that we can avoid this region, yet stabilize the ATFL and CFL, then we're gonna have some progress. The other thing you have to think about is a dancer needs to be able to get into full dorsiflexion when she's doing a demi-plie, and she also needs to be able to achieve full plantar flexion. The challenge is we want to avoid this type of a positioning, that plantar flexion inversion. So if we can stabilize the lateral aspect of her ankle and help her achieve the other mobility, then she can get back to functioning at a higher rate, right? So I'm gonna go over a taping technique, and then I'm gonna show you how, once I would get my dancer to the level where I feel she's ready to get on point, and again, some of the things that I'm gonna use for criteria are pain, having adequate range of motion, and there's an episode that I gave you earlier on point readiness. I would apply all of those principles even if a dancer is an experienced dancer. You wanna take them through that functional testing to see if they're indeed ready to get back to point work itself. When they're ready for that, you can get them in their toe shoes and even just have them wear them for basic bar activities, and maybe they're not getting into full on point, but they're getting into demi point. So I'll show you that. But here we're gonna go over, and Amber's gonna hold this for me. So let's see, you might have to flip that around, maybe. You got it? Okay. So scooch down a little bit. Okay, so what we're gonna do, so you just need, now you can use leukotape initially, but then as the dancer gets more control, I would progress this to kinesiotape because it's going to give them a little bit, again, more motor control and mobility. But initially, when this is a little bit less stable, we need a little bit firmer of a tape. So you're gonna come up over that medial malleolus right here, okay? Just distal to the medial malleolus. I'm gonna have her dorsiflex. And then what I'm gonna do is I'm gonna come around, keeping that dorsiflexion, and I'm also gonna kind of slightly evert her, and I'm gonna come right up over that ATFL. So I'm giving like a nice compression there and some support, and then I'm anchoring that here, okay? So that's tape number one. And relax. And I'm just showing you this with this tape, but again, you might want to do the white leukotape. It depends. Now this could irritate the skin, but often if they're in a performance and they've just got to get just the brown, they may not be able to have the white because it might affect their costuming, or they could put some makeup over it so that it doesn't get detected, right? So for the second tape application, we're going to come right over that area again, and I'm going to come around. But this time, dorsiflex for me, I'm going to come more over the CFL and bring that up. Now I would have made this tape, actually I would suggest you make it slightly longer, but for time's sake I'm not going to do that. I would do that tape so it's a little bit longer and get it way up here so it's more secure. So what I want you to do, and hopefully this sticks to her skin, because I didn't prep her skin, taping faux pas 101 here. But anyway, what I want you to show, Amber, go ahead and point your foot. So look at that. So she's able to get full plantar flexion, but go ahead, and what I want you to try to do is go ahead and invert your foot like this way. So when she does that, if this was sticking properly, which again it's not, I figured that wouldn't, but this would give her a little bit of some support. Feel that restriction? Yeah, so that is a nice helpful technique to restrict. So again, I would play with that and make sure it's really sticking to their skin, whatever you want to apply to the skin, and get that. But support those regions. And then she can get into full dorsiflexion. And if you notice, the beauty of this is she's not getting anything over that Achilles tendon, which can again be an area of aggravation. So play with different strategies, trying to respect the fact that a dancer needs to have that mobility available to them. Okay, so now what we're gonna do, we're gonna go over some point work. Okay, I'm gonna change this up. Okay, and my ballet bar isn't installed yet, so we're gonna use a rig, but I think it's kind of cool. You don't have to have a ballet bar is my point too. So what I would do with the dancer is I'm going to progress from a parallel position facing the bar. So what you would tell her is you can face the bar. So when she's facing the bar like this, she has some support, right? So in this position, what you're gonna do is you're gonna tell your dancer, I want you to come up into en releve. So she's gonna come up all the way on point. And what you're looking for when they're doing this is, and I would have your dancer bring her toe shoes in the clinic, you're looking for a few things. You're gonna look, is she getting fully on the box in her toe shoe? Is she, go ahead and show a bad sickle for me, if you can, Amber. Some dancers, and you don't have to stay here, you can see how this would not be ideal. When they lack the strength, they're gonna come out in that fashion, so you don't want that. You want her to be able to come fully on point. Go ahead and come down. And you wanna see that she can fully articulate. And you're looking for, again, does this dancer have good range of motion? Do they have proper control? And come down, she's doing a great job doing this on one foot. We didn't have time for 2 toe shoes. Okay, and so we're looking for range of motion, we're looking for pain. Does she have any pain? Does she have that control? Is she getting adequate control there? And then as we move up further in the kinetic chain, Amber, go ahead and show a bad one where you're gonna bend your knee, come down, how a dancer would do that improperly. So if they don't have the proper control, see how she's gonna compensate and bend up here. So you wanna make sure the dancer really does have that strength, that she's able to keep the knee straight as she's coming up and down. Go ahead and come down. And then we're gonna move up into the kinetic chain even further. And Amber, why don't you show at the hip, like how we would do a bad. So see how she did that through her lumbar spine? So we've talked about how this is an entire kinetic chain issue. So does she see what she's doing swaying? So that comes down to when we're rehabbing our dancer to get them to this point come down, it's all about having proper neuromuscular control. So before you get to this point, you're really working on all of that PNF patterning, getting their motor control, and doing all those exercises that we've talked about historically, right? So then, I'm gonna turn this around. What we would do, once she's good and she's solid there on 2 legs, we would progress to single leg. Again, holding onto the bar, right? So she would come up just on the right leg and work on the same strategies, and we're looking at the same, does she have that control, right? For that type of movement. Good, and then come down. And then once the dancer feels pretty confident, when they do bar work, they're going to be to the side. So before I would do that, I would work into turnout. So go ahead and get into first position. So again, now turnout is a whole different ball game. So we're looking at all the variables we talked about. Are they achieving turnout properly? And that I could talk for hours on. And if you come to my course, we'll go into great detail about what we're looking for there. But in this position, what I want you to do, go ahead and come up onto releve here. Same thing. So from this perspective, how is she getting onto point? Is she using good strategies? Does her foot look like it's properly on the box? And then come down, and we're seeing, does the dancer have any pain with this activity and what's happening up in the kinetic chain? Go ahead. Up. And it's weird because she's on 1 foot. She doesn't have her other toe shoe on. Come down. So you would go from double-legged to single leg. And then go ahead and face the side. Face me, I guess, Amber. Yeah. So we would get her in the side, and she could start in parallel, and she knew what to do. So she'd be in parallel, and she can work on, again, coming up into releve. Now she only has 1 arm to support, and this is typically what we're gonna do in ballet bar, is go from facing the bar to 1 arm type exercises. And then she could go from here to single leg, and then she could go to turnout, and so forth. Perfect. We're looking for all the different things. And once the dancer gets really we're going to move from that bar work to center, right? Because in center, they have no more support. So Amber, come on out. And I know we didn't practice this. But what she could do in center, so now this is a whole different world. She's got to be able to support herself without having anything to hold on to. And she could work on whether it's different adagio type exercises, you just go ahead and stand on one leg, different balance exercises. You could tell the dancer you can start in center and do these exercises. And eventually we get into more extreme type positionings, and I'm not going to ever do it because I didn't prep her for it. And I don't want her to get hurt. But what we would do then, the dancer would go from bar work to center work. And then from center work, what they do is she's going to start with more of those static type exercises and then get into more complicated type movement patterns, whether that's turning, jumping, and so forth. So you can see how that's kind of a progression. So the whole time we're looking for, does the dancer have, thank you Amber, does the dancer have the proper mobility? Are we getting any swelling? Are we getting any pain? All those standard things that we know to look for, but then looking for the proper motor control and movement patterning, right? So I hope that helps you. And again, I'm going to be teaching this course coming up in Vegas in September, and we will go into detail of even manual techniques we can do and all sorts of fun things, because this is a very important injury to address. It gets very complicated. And it's super imperative that your dancer can get back to point work. It's a big fear that they have, and they certainly can get back to point work. So I hope this helps everybody. Feel free to reach out to me, and please give me ideas, because I'd love ideas of what you might be interested in me giving. So have a great day. Have a great Tuesday. All right. Bye, everybody.